Though tribe and tongue may differ, in brotherhood we stand. Nigeria all and proud to serve our sovereign motherland.
In a renewed effort to revitalize Nigeria's primary healthcare system, Nigeria Health Watch, a leading non-governmental organization known for its impactful health advocacy, brought its global policy and advocacy campaign to Lagos State, Nigeria's bustling commercial hub.
This settlement, they don't have health facilities, they don't have health posts, and that's where we have option of outreach.
On Tuesday, April 29, 2025, the organization hosted a one-day intensive capacity building program at the Lagos State Chamber of Commerce and Industry LCCI Conference Center at Lausa Ikeja, bringing together healthcare professionals and members of the community media. The training offered a strategic platform for primary healthcare workers and community media practitioners to gain deeper insights into upcoming health projects in Lagos, understanding their specific roles and align their efforts towards delivering effective community-based healthcare services.
Community engagement strategy.
Facilitating the session was Sophia Shuhaib, Deputy Director of Advocacy and Partnership at Nigeria Health Watch. In her keynote address, she outlined the organization's mission, previous successes in Kano and Niger states, and strategies to push to extend that impact to Lagos.
This is our second year and we're expanding to Lagos and Kaduna. That's why we're here. So this global policy and advocacy project, like I mentioned, is a Gates Foundation funded project, and we are interested in strengthening accountability for primary health care, contributing to government's efforts to crash maternal and infant mortality, and just improving health outcomes generally for the country. So in 2023, you may be aware that the Federal Ministry of Health, under the Coordinating Minister of Health, unveiled a strategic blueprint that is designed to strengthen community engagement, social accountability, while focusing on the reduction of maternal and infant mortality rates, especially in some identified locations across the northern part of the country and the southern part of the country. Now, as a health communication and advocacy organization, we are holding duty bearers accountable for all the policy directions and programs that they have designed and are implementing. So holding duty bearers accountable is one of our roles that we do, and we do citizen engagement and education also. So we want to ensure that people are informed with the right tools to make informed decisions about their health. So when that strategic blueprint was unveiled in 2023, we decided that we were going to tailor our community engagement strategy to track the accountability of that initiative, and at the same time to keep citizens informed about what is going on, the new trends, why the ministry is going in this direction, and what the focus is, and to make sure that citizens' voices are included in this planning.
Participants were taken through a series of interactive workshops that covered topics such as solution journalism and its application in health and advocacy, how to source and pitch credible community health stories, effective storytelling from primary health centers, and leveraging social media to drive health campaigns and awareness.
So solutions journalism provides like a counterbalance. Yeah, you can say that people are suffering, but where people are suffering and people have not left the place, that means that something is wrong. There is something keeping them there, no matter how little it is. So when you focus on it and you say, okay, this is what is keeping people there, this is what is keeping people hopeful, then it's kinds of balances. So you say, yes, people are suffering, this is what's happening, but then this other thing is also happening to just keep people hopeful. So it balances it and it inspires hope. Today, if I say in Ukorodu there's this good initiative, in another local government, it can inspire people to like act. It can inspire them to say, okay, since this local government is doing something this good and it's helping people, why not us too? We implement that or we push for that. So yeah, if you highlight like solutions in one community. It can inspire hope and encourage other people to also emulate from that solution.
If you look at how a tree is, the tree has roots and the branches that we can see outside. But most of the time when we view a tree from afar, looking at the branches, maybe we are seeing some yellow leaves, we might decide to say, oh, this leaf is not growing so well, there are problems. But what we are seeing is just effects of the main issue. The main issue is here, which is from the roots, the causes of the problem. And most of the time when we want to do analysis of a problem tree to find out cause and effect of problem, we do it in a stakeholder engagement where we call everybody together, both from the state, WDC, community people, private sector, to now say, okay, let's look at the real issue, which is the root cause of the problem. And from looking at the root cause of the problem, you might decide to say there's one core problem you want to solve, which is, for instance, healthcare access to a particular community.
Because like someone can come and say, oh, I've been here for 5 hours, they're not giving me care or something. I may not be true. Or someone says there are too many people using this, or can come up with this. There's an instance they came up in Canada that happened, I've forgotten the pack given to children, the malnourished children, more walnuts or something, I've forgotten the name, that someone said they were selling it. So we had to verify, is it actually happening or not? So we have to verify these claims that community members give. We have to verify them. And as I said earlier, we work together with health educators now and local networks to assess how to reach stories in communities.
The attendees, drawn from various PHCS and community media groups across Lagos, expressed gratitude for the timely training. Many committed to partnering with Nigeria Health Watch to amplify health messages and bridge the information gap in underserved communities.
In fact, it's a very lovely program. It's a collaborative program. It's a program whereby we can even seek for your assistance and we work together for the benefit of the Lagos State.
What we try to do today is to bring the head community leaders and APCOM together so they will be aware of what is going to happen. Because there are going to be radio sensitization. There are going to be town hall meeting in 6 local governments. We are going to have consultation with the permanent secretary, commissioner for health and government people. So what we are trying to do today, so people will know that, oh, these things are going to happen, but this is APCOM program. Nigeria Health Watch has decided to work with APCOM so that they can be able to use them to get to the grassroots.
I see that this is like an advocacy group that we are trying to put things in order, align our programs, ways of disseminating information in a way that will be cleared and well understood by people in the community, both online and offline, and how to make use of our information to enhance our government to do more, to know the loopholes and way to come in to people's health, especially to improve all our health facilities, to encourage all our health personnel, and to make sure that people are happy making use of our health facility. So this is a group that we are trying to put things right so that we'll be able to be in between the community and the government. So the community will be happy, the government will do more, and the people's health will be adequately improved.
You see, information is key in our community, and the more we know about our challenges, the more we provide solutions to it. And you cannot do that without properly building the capacity of media people in the grassroots, and that's what Nigerian Health World has done with this today's program, to build the capacity of health education in the grassroots and co-opting Association of Practitioners of Community Media in Nigeria, the members, to be part of it so that we can effectively report what's happening in the grassroots. And this is very laudable, very good one.
Speaking exclusively to Claire TV, Safiya and Zubaida, another key program lead, reaffirmed the organization's readiness to kickstart its advocacy campaign in Lagos with a goal to improve health outcomes, elevate local voices, and build a resilient primary health care system in partnership with grassroots actors.
What we want to do is to be able to ensure that citizens' voices inform the revitalization of these primary healthcare centers. We understand that the government has very laudable initiatives, but how much of it is tailored to the need of the people in the community? If government has this insight, they'll be able to do exactly what the community needs. It might be more healthcare workers, it might be infrastructure renovation, it might be provision of water, sanitation, it might be solar, ensuring that this is well lit. So many needs and nuances, and what we want to do is to make sure that the government is aware of what these needs and nuances are.
My expectation is to see like humanized stories, right? Humanized stories of real people and real problems or real solutions, and to just make sure that we bridge the gap. Wherever there are gaps, we hope to bridge the gaps, just like we have done in Kano, just like we have done in Niger, especially with the family planning arts education thing, because a lot of young people want access to information but they do not have access to it. So if we drive this kind of programs in Lagos, it can help like bridge some of the gaps we have.
As Nigeria Health Watch plants the seeds of advocacy and awareness in Lagos, the hope is clear. A future where every community has access to quality primary health care, powered by informed caregivers and empowered storytellers. From the heart of Alausa to the grassroots of local wards, the message is loud and clear. Health is not just a service, it's a right. And together, we'll protect it, promote it, and ensure it thrives.